Hi, I'm Rashanah Baldwin, a journalist, a Chicagoan, and a millennial bringing light to everyday stories that matter. I share the type of stories that mainstream media ignores or gets wrong. The news of the neighborhoods, the news that matters. Here is someone you need to know. Welcome, Alderman Roderick Sawyer of 6th Ward. How are you doing?
I am doing well today, Rashanah. How are you?
Good. How are you doing amidst COVID-19? What is the morale like in your ward?
Well, I'm saving lives by sheltering in place, staying inside, not spreading or receiving anybody's communicable diseases. We're doing well though, but we're staying busy at the office. We're still getting work done. We're passing out masks. We've been in the office between 12 and 2 a few days a week so that we can distribute masks to those that need them. We're also taking general requests by emails and phone. Our staff is working full time all day. So we're handling it in this new normal.
What does it feel like to be an alderman during these times?
Well, I guess it's still the same. I mean, we get blamed for everything, and everything is our fault. But we're still working hard. Just because we're not physically in the office as much, that means I'm on the phone that much more. I've never charged my phone this much in my life because I'm always on it from sun up to sundown.
You muted yourself.
We speak. But they're constant, and work is still going on. So we're dealing with it.
What are you doing to keep the residents of the 6th Ward informed of factual information and even factual health information?
Well, we always encourage those to visit our website, sign in to be a member. That's the number 6, WARD.com. We have weekly e-blasts that go out every Thursday. So every Thursday you get a new e-blast with COVID information, still with job information, food pantries, all the things that you would want to have during this time. It's on our e-blast, and they come out, the new one goes out every Thursday.
Wow. Okay, that's good information to know. Is your ward receiving help from the state? Is the wards getting any type of assistance from the states? You mentioned masks, that you're passing out masks. Were you responsible for getting those masks, or did those come from the state?
Well, we've gotten masks from a variety of individuals. Obviously, Willie Wilson and the Willie Wilson Foundation, want to thank him for providing us with a lot of masks. The city of Chicago has provided us with some protective devices as well. We had some private entities, some businessmen in the ward have provided us with masks and gloves. So we've been blessed with having a variety of individuals assist us, and we try to do that in turn. So when we get them out to our block clubs and our community organizations that are really have boots on the ground, that are doing work in our various communities, whether they're delivering food or helping in other ways. We want to get them to those that are really on the ground doing the work.
I noticed in the media and the news that Black and Latinx communities have the highest disparities. What can we do to address that as it relates to COVID-19? Not even just health disparities, but it wasn't really a surprise to me that Blacks, got the highest disparities amongst their non-Black colleagues, friends.
Well, this is what I have to say about that, and I may get a little pushback, but as you know, I've been trying to advocate for reparations for some months now, and I don't think of a better time to talk about reparations and disparities between Blacks and others than right now during this pandemic. We are experiencing higher levels, as you stated, both the Black and brown community, but I'll talk about the Black community for a second. We're disproportionately high in infection rates and in deaths. And that's a problem. And I think as we learn about the epidemiology of this, we'll learn that genetically we might be predisposed to this. And this comes back all the way back from slavery. I'll talk to doctors about this, and we're going to hopefully have some town hall meetings about this. But this is an ideal time to talk about the repair of Black people. What can we do to help ourselves when we're in these types of situations? You see a very small amount of white people dying because of this. They get infected because it has no boundaries. It doesn't attack people because of the color. It attacks who it attacks. But they seem to come out of it okay. We're dying. So we have to really dive down and really try to find out what we can do to protect ourselves going forward. And I think this is an ideal time to talk about reparations.
Could having more testing centers readily available on the South Side make a difference?
Testing centers do help. They're expanding. I do appreciate that the state is expanding testing opportunities throughout the city of Chicago. Beloved Community, for example, in Halsted has become a testing center. We have one on 84th and Cottage. We have them, a lot of them are not in my ward, but they're directly surrounding our ward. So they are close by. People can have access to them. And we would encourage those, if you're experiencing symptoms, to please go get yourself tested.
It seems like there are testing centers, or at least some, but we don't know enough about them being open to on the South Side. I had a conversation with another alderman who mentioned that some of them closed because they were underutilized on the South Side, but people like you, him, me didn't know about them because they wasn't really being advertised. And
well, like I said, for example, we do on our Thursday e-blast, we list and update the testing centers that are surrounding our area. And we try to keep that updated as we get new testing centers or those that may close. We want to make sure people are aware of the ones, not just in our ward, but surrounding our area that are close by where people can take advantage of the opportunity.
What could the state legislators do to address the disparities?
Well, again, this is a kind of a wait and see kind of situation. I think all of us are relying upon the medical professionals to kind of guide us through this, and and all the health professionals that are giving us good information every day. And the best information right now is for us to shelter in place, stay distant from people. This is the only way that we know that we can stop the virus. So let's heed that, and particularly for our younger people, I want to make sure that we heed that advice. That's very, very important. This is the only documented way that this disease can be halted, is to stay away from others. Don't breathe on people, allow people to breathe on you for right now. And if we do this for a little while, it will pass, and then we can go back outside. I'm just as anxious to get outside as anyone else. I enjoy being out in the weather. I'm a social person. I want to make sure that we get out as well, but we have to do this. This is important.
What are your feelings about how the mayor and governor have been handling
I think both the mayor and the governor has been doing a good job in keeping us informed, making sure that the governor had to make a tough decision when he decided to close down. That was a very, very hard decision to make. That's really governing at its finest. Also, the mayor's been doing a great job. I'm glad that she's taking in stride all the memes that have been out there with her in them.
Right.
And she's taking it in stride. She's getting kind of a kick out of it. And we've even put out a couple of PSAs ourselves to talk about it. We put out one that was kind of self-deprecating, kind of funny, about myself, how I'm saving lives, making sure that I stay inside and do what my wife tells me to do primarily.
Exactly. Wife knows best.
That's right.
What do you believe the new normal will be like for your colleagues in City Hall in terms of how you run your ward?
Well, the good thing about all of this, my colleagues and I have a lot more conversations going back and forth on a daily basis. We're in the Black Caucus. We meet probably once, twice a week at least by way of Zoom or conference call. We're talking a lot more. We're trying to collaborate on more things, which I think is always helpful for the city. So overall, I think it's been pretty good. We're taking advantage of this time where we're sitting around on a phone all day and we're talking to each other. I talk to my colleagues across the aisle. I talk to my colleagues from all over the city now because, what else do we have to do?
What do you think the new normal will be for the people who want the public and coming to City Hall?
That's probably, quite honestly, I think that's probably the part that I miss. I do miss the interactions with people. That's why, even during mass distribution time, I'm the one in the front window. When you come in the door, the first person you see is me. I've had people that tried to deny that it was me because, you know, I had a hat on and a mask. It's like, you're not the alderman. That's not you. I said, yeah, it is me. I'm here at the front desk helping, you know, because I like social interaction. I like to talk to people. So I actually kind of missed that.
Do you think once the shelter in place is over and things go back to normal that you will have ward night immediately? Would it still look the same?
You know, that's a very good question. Again, I'm going to let science dictate that, but I'm sure that we're going to have a new normal going around some kind of way. You know, this during something that's as transformative as this, there's going to be changes in how we deal with each other forever from this point forward. So I don't know what they're going to be, but I'm going to embrace them. I'm hoping that it does not take the place of human contact. You know, I still prefer us to have human contact, to have ward meetings and have people come to the office and get their business done. We want to continue that. We want that to continue to happen, but we know that things are going to happen differently, and I'm going to wait till science tell us how we're going to live our lives.
Thank you, Alderman. Any final thoughts that you want to share or give to your constituents?
Well, I just want to say thank you to all those that have been supportive and those that have called the office and came by and got masks or called the request. Those that are continuing on a call, use us and 311 for your city services. But primarily at this time, the most important thing I can tell everyone is to stay home and save lives.
All right. Thank you, Alderman Roderick Sawyer of the 6th Ward. Enjoy.